Hello, good morning. Again, this is Dr. Dennis Latuno, and today we're going to be discussing about atrial fibrillation, or AFib for short. But before we start with this discussion, I'd like to just short introduction about the anatomy of the heart. Remember, there's 4 chambers in the heart. The small chambers are called the atrium, the left and the right. And also the large chamber are the left and the right ventricles. And then the electrical activity of the heart, there are electrical activity coming from the SA node, which is in the right atrium, and then the AV node, and then the fibers, Purkinje of fibers that send signals now to the left and right ventricles. So what is atrial fibrillation? Usually in a regular rhythm, heart rhythm, the signal travels from the SA node in the 2 upper chambers of the heart, and then the signal goes to the AV node. And then the movement of the signal causes your heart to squeeze or contract, sending blood to your heart and other parts of your body. But in atrial fibrillation, the signal in the upper chambers are chaotic, or the upper chambers just quiver or shake. The AV node is bombarded with signals trying to get through the lower chambers, and this causes a fast and irregular heart rhythm. The heart rate in atrial fibrillation usually ranges from 100 to 175, and of course your normal heart rate is 60 to 100. Symptoms of AFib including chest pain, palpitation, dizziness, fatigue, weakness, and shortness of breath. Classifications, therefore, paroxysmal, persistent, long-standing, persistent, and permanent. In paroxysmal, the symptoms usually comes and go, sometimes for as long as a week, and then happens again. But some doctors will prescribe blood thinners to prevent stroke on a patient with a paroxysmal AFib, especially if you have a history of heart failure or hypertension. And in persistent, the heart rate rhythm doesn't go back to normal on its own, and usually cardiologists will recommend cardioversion on this one. And then long-standing, usually the AFib is more than 12 months, and then permanent, it doesn't go away. The only treatment offered is rate controlled and prevention of stroke. Possible causes of AFib including coronary artery disease, MI, which is heart attack, heart valve problems, high blood pressure, lung diseases like COPD, previous heart surgery, sick sinus syndrome, sleep apnea, hyperthyroidism, and also stimulants like alcohol, caffeine, and even drugs like methamphetamine. Complications of atrial fibrillation include blood clots, stroke, and heart failure. That's why doctors will prescribe blood thinners to prevent blood clot formation and stroke. Risk factors including advanced age like 65 and above, heart disease, high blood pressure, hyperthyroidism, alcoholism, and also family history. Diagnosis includes doing an EKG or ECG. In the EKG, usually you'll see an irregular rhythm, and then there will be no discernible P waves on the strip. Blood test, you check for stimulants or drugs, and also for hyperthyroidism. And then Holter monitor is like an EKG, but is usually for 24 to 48 hours to check for irregular rhythm, mostly for like AFib. And then event recorder is also a Holter monitor, except it lasts longer, usually 30 days. And then if you're having symptoms, you push a button to record the event. And then echocardiogram to check for heart valve problems and enlargement of the atrium. And the other doctors will do stress test, EKG, meaning chest x-ray, to check for lung problems. Treatment includes medication, cardioversion, and surgery or catheter procedure. The medication we use are usually the beta blockers like metoprolol, calcium channel blockers like diltiazem, digoxin, and then antiarrhythmic drug, which includes amiodarone, sotalol, plecanamide. And then blood thinners usually use coumadin or warfarin, Eliquis, Pradaxa, Sabesa, or Xarelto. Remember, if you're taking a blood thinner, you have to, if you develop any signs of blood or bleeding, you have like epistaxis, vomiting blood, or blood in the stool, you have to stop the medication right away and go to the nearest emergency room. And then for persistent AFib, cardiologists will do cardioversion therapy, which is a method to reset the heart rhythm, done by sending electrical shocks to the heart through paddles placed on the chest. Cardioversion is usually done in the hospital as a scheduled procedure, but make sure that the patient is on a blood thinner for several weeks before they can do the cardioversion to prevent or reduce the risk of strokes. Catheter procedures, number one is AV node ablation. Usually they either place a heat or cold energy applied to the heart tissue at the AV node to destroy the electrical signal connection. After the AV node ablation, a pacemaker is needed for life. And usually it's done by electrophysiologist, cardiologist. Of course, it's done in the hospital. And then the other one is a mace procedure. Again, the cardiologist will apply heat or cold energy or even a scalpel to create a pattern of scar tissue called the mace in the upper chamber of the heart. Because the scar tissue doesn't send electrical signals, the mace interferes with the stray heart signals, causing the atrial fibrillation. And then there's another procedure called the Watchman procedure, This one is to prevent blood clots or stroke, and usually this is done also in the hospital, where the cardiologists have to insert a catheter through your groin all the way to the left atrial appendage, this one, and then they deploy this umbrella-like structure, and they usually put you on a blood thinner for about 45 days because after 45 days this area should seal up through the formation of endothelium. And then prevention, you need make sure you stick with your healthy diet, meaning cardiac diet. You need regular exercise, don't smoke, avoid alcohol, caffeine, and drugs like methamphetamine, and manage your stress carefully. Again, it's Dr. Latuno. Thank you very much for subscribing. Make sure to like and share my channel to your friends and loved ones. Again, Dr. Latuno saying bye, see you next time, and God bless.